Cultural humility means opening up a conversation in a way that genuinely attempts to understand a person's identities related to race and ethnicity, gender, sexual orientation, socioeconomic status, education, social needs, and others. In healthcare, cultural humility is defined as having traits of respect, empathy, and critical self reflection at both intrapersonal and interpersonal levels. The intrapersonal component involves an awareness of the limited ability to understand the worldwide and culture of the patient. The interpersonal component incorporates the stance towards the patient that is marked by respect and an openness to the patient's worldview. Cultivating cultural humility is fundamental to the ethical foundation of the nursing profession. Respect for the dignity of every person, regardless of a unique characteristic, is a central component to the profession's code of ethics. I have found that there are about four elements of the culture of humility: the self reflection, self critique, learning from patients, partnership building, as well as having a lifelong process. Self reflection and self critique involve acknowledging our own assumptions and beliefs. Self reflection coincides with the interpersonal aspect of a culture of humility. The interpersonal component of cultural humility is also focused on learning from patients through listening and partnership building. Cultural humility is a foundation for developing the type of environment that promotes an appreciation for understanding others, developing for other cultures. Cultural humility combined with crucial conversation skills provides an opportunity to talk about involving intercultural pain, cultural misunderstandings, and the development of cultural understanding. In effect, humility should be a lifelong process as well as a goal for everybody. Nurses can apply this into their care by initially starting with their own self reflection. Every nurse is going to come across having some sort of bias, and acknowledging your own will help you approach patient care with cultural humility. Care begins with introducing yourself and sometimes indicating your own pronouns. This can set a tone by establishing a respectful, culturally informed, and therapeutic care relationship. Never underestimate the social history's power. So, social determinants of health, including the patient's culture, work history, living space, access to food, transportation, and support system, have a tremendous influence on their access to and desires for care. By listening to their social history, nurses can tailor care plans for each patient. Be careful not to stereotype or discriminate as well. Embrace lifelong learning and allow patients to tell you their thoughts, beliefs, practices, and capacity to manage their care rather than relying on your own preconceived beliefs. If a misstep happens, always apologize and ask how best to avoid it in the future. Support diversity, equality, and inclusion in the nursing workforce. Those without similar lived experiences cannot fully understand the context of a patient's life. The definition of social justice resolves around the concept of equality and human rights. It pertains to the opportunities, privileges, and wealth of people around the world. Social justice examines how these rights are manifested in the lives of individuals. It also aims to redress inequalities based on gender, race, religion, age, and other characteristics. While discrimination affects social justice on a global level, many leaders strive for human rights and equality for individuals. Social justice in healthcare translates to the delivery of high quality care to all individuals. Achieving social justice is critical in healthcare to ensure that all individuals can maintain their highest level of health and wellness. Factors such as education, employment, socioeconomic status, and environment can affect an individual's access to healthcare. Healthcare administrators should be aware of individuals and groups that have been historically marginalized and are currently vulnerable to inequality in healthcare. Administrators can advocate for these individuals and groups by designing strategic models of social justice and healthcare. Healthcare administrators can effectively incorporate the following models for promotion of social justice into the healthcare strategies, such as one example being training nurses to be advocates for the patients, which is one of the number one roles a nurse can be for, for our patients, is being an advocate for them. The role of nurses revolves around intervening on behalf of patients, providing efficient, compassionate medical care. Nurses are going to carry out the ethics and values of the medical facilities they work for. So it is important to provide training for these nurses to ensure that nurses are culturally competent, advocating for the patient's rights, and providing the highest level of medical care to all individuals. Madonna's values of respecting others and providing justice and truth for all fits perfectly within all the practices that I have just mentioned about. Advocating for our patients and being non-judgmental and helping provide equality for all is what Madonna is already practicing and teaching us. And I'm sure all of us are already practicing this while we're in our clinicals. This is only going to help us be better future nurses and help us in our careers as well. Something that I've noticed that a cultural practice that is practiced frequently is meditation. I've traveled frequently over in Asia and noticed that this is a very big practice over there that they use for mental health as well as for physical health as well to help practice reduce stress. I've also seen some patients in the hospital practice this. So this is a fairly common practice that has been studied for its benefits in helping battle mental illness as well as anxiety. Um, Meditation is often used for other health problems as well, especially for pain disorders. So both practices focus on self-awareness and using the mind to better control the body. This improves the control of mental state, which may help the patient overcome pain, anxiety, and other stress. Many patients are going to practice this in conjunction with other medical therapies to help them combat diseases as a whole. Meditation practices are very diverse, and sometimes they might even include yoga and Tai Chi, which can also help aid in patients with self awareness and balance. It's important to understand the different modes of healing that patients might want to explore and help to support them do this. Something that I notice with patients that I've had in the past that do like to meditate, what I do is I ask them what time of the day they prefer to do so, so I can make sure that during this time they're not being bothered by me coming in, so I can respect them having their privacy during that time and having that alone time to practice. So I would suggest always if you have a patient that wants to do this throughout the day, is just figure out if maybe there's a certain time of the day they like to do it, and during that time, let them have their door shut, give them that time without having any interruptions and making sure that everybody else on the floor knows to not interrupt the patient during that time as well. Okay, thank you very much for listening.